let's talk about the mouth. Tell me, what are some things that people don't know is related to not having good oral care? Like, what are certain diseases or certain conditions? If someone's got low energy, or tell us, blow our minds a bit.
What most people actually don't know is that the mouth is the entrance to your body, and basically all chronic disease have a link to the oral health. So bad oral health equals poor overall health. It's linked to heart disease, cardiovascular disease, metabolic issues, insulin resistance, Alzheimer's, neurological disease, Parkinson's, depression, mental health issues, you name it.
Okay. And how does somebody know if they have a problem in their mouth? If there's a problem brewing in their mouth, how do they know?
So first of all, have you ever had dental work done in your mouth? Then you know you had a problem. And there are three questions I would always ask from a biological point of view, which is, number one, do you have or have had any metals in your mouth? Number two, have you ever had a root canal treatment? And number three, did they remove your wisdom teeth? Those are the questions that directly refer to the oral interference, or the three health killers that are lurking in your mouth and you're probably not even aware of.
So let's go through me as an example. Did I have any fillings, any metal fillings? The answer is no. Okay, so good there. Number three was wisdom teeth. I did have those taken out. Okay, bad move.
I tell you later, but
let's get back to it. Number two was root canals. You know what? I don't even know if I've ever had a root canal. I'm not sure. I'm pretty sure I had one when I was younger. It definitely was not after like the age of 10 or 12 or something. Like, I would have remembered that, but I don't know if I've ever had a root canal. Is that weird?
No, actually, a lot of people don't know they had a root canal. Obviously, I think you didn't have one, because it's a massive painful treatment, and usually you need it because of massive pain. So you would probably remember the pain, because the root canal treatment is unfortunately necessary for a lot of people as an acute pain treatment, because otherwise you just die from the pain. So,
okay.
But
I probably did not have it. The wisdom teeth got me. Now I got to be careful. They got me. They told me I needed to take my wisdom teeth out, or else my teeth would crowd up too much.
And this is totally normal. I would say this is the usual thing in the Western world, but it is 100% unnatural. So why would nature design us to have no space for our wisdom teeth? It makes no sense. If you go back to Weston Price,
let's talk about this for a second, because I think this is a really interesting point. Why do people's teeth suck in general? Like, people have really crowded teeth. Like, if you go to, especially in developed worlds where they're not putting on much braces, or countries that don't fund braces, or where people don't really care, you see people with like a lot of crooked teeth, especially on the bottom. It's just all crowded together. How the hell does that come about?
So it depends. So I don't believe that all straight, everything 100% aligned is 100% natural. So even I have a little bit crowded teeth, but if you really go to places where you fully live the ancestral way of life with no contact to processed foods whatsoever, like Weston Price showed 100 years ago, you actually have a perfect set of 32 teeth, maybe a little bit misaligned, but not crowded. And you have a perfect posture. You breathe through your nose. Everything's kind of like natural, because nature has it right. It's the beauty of it. But as soon as we get in contact with processed foods, gluten-containing grains, sugars, refined vegetable oils, and all the processed stuff, we get weak and soft, and we get problems in growing up. So basically our body, or the architecture, and doesn't happen the way it's supposed to be. It's basically an epigenetic issue. It starts in the womb already.
So what are these hunter-gatherer tribes like in terms of their oral health? Do they have crowding? Is there, what do their teeth look like? Do they brush their teeth?
Usually no. Usually if you eat if you look at Hadza and let's say Maasai, really people that tribes that are still 100% hunters and gatherers, they don't brush their teeth. Maybe they use a stick or something, but they eat hard foods and not so much processed foods. Those foods brush your teeth in itself. They clean your teeth. And also by chewing hard stuff, you get hard teeth hard as stone and wide jaws. And you support your body with the right nutrients in your upbringing. And this is what I said, it starts in the womb. It doesn't make any sense to start now when you're 32 years old. Obviously, it still makes sense, but
what does it mean, starts in the womb? Like the mother has to eat this food?
Basically, a mom should be prepared for pregnancy already, like in this unnatural world, but eat good food. Then you build a good, healthy baby. The set of teeth, the first set of teeth is already developed in like the 20th week of a unborn child, like really.
Oh, early. Wow.
And the second pair, like these teeth, they are already also growing. So they are there when you go, like the dental buds are already also developed very, very early. So you see,
I didn't know that. So you're saying that dental health really starts with your mother?
Yes, basically all your health starts with your mother. And
right.
also, obviously, if your mom is super toxic, and she doesn't take care of it, then all the toxins go directly through the placenta into the unborn baby. That's also
that's true, but we don't. We tend to think of like, generally when people, I think when you look at people, you look at kids, if a kid is relatively healthy, if they're living relatively healthy, they're usually healthy, right? If they're not eating just junk food all day or whatever, if they're eating a good diet, then the kid is going to be healthy, even if the mom wasn't perfect, right? People seem to be pretty robust in that sense, and the health problems really come later. The thing is with the teeth, though, you don't necessarily see that. You don't see that if somebody is eating relatively healthy, they then have really good teeth. Like they generally need dentists. And so something seems to be wrong in how things are occurring, whereas you're saying that these ancestral tribes don't have weird teeth. Like some people just have weird teeth. Like it's growing in weird places. It's like rotting and a whole bunch there's like so many problems.
I see your tooth or your mouth as a mirror to your overall health. So if you have rotten teeth or weak teeth or mushy teeth, this is a sign of overall issues. It's a deficiency because a tooth in itself is hard as granite. You can measure this if it's natural. You can get harder. But in the Western world, it's getting softer and softer and softer. Therefore, we are trained as dentists to recommend fluoride toothpaste because that makes the tooth harder. But in itself, your diet, your minerals, your lack of proteins, will your teeth make soft in the first place. So hunters and gatherer tribes, at least the ones that Weston Price visited 100 years ago, they have perfect teeth. But this is why this book is so great, because you can see their children getting in contact with processed foods, having no adoption to these foods, and they look like monsters, crowded teeth, mouth breathing, full of gingivitis, periodontitis, lots of calculus, cavities, nose crowding and spacing issues. Basically, they look like our teenagers in the Western world. So in Germany, in the US, like all here, Europe, it's Western world for me. And most of us need braces. And most of us have no space for wisdom teeth. Most of us are just grown too narrow. And this starts in the womb. Then there's breastfeeding. Breastfeeding builds your jawbone. Mouth breathing, nose breathing. You see, this is like an ongoing process. It's not just the womb. It's just where it starts, maybe even further.
Right. And I guess, I mean, the only problem with the argument about, well, nature has wisdom teeth, right? So then you definitely, you need them because nature has them. And by the way, I believe in that argument. The question is, because of how we are living now, right? And the fact is that we do have crowded teeth, for, some of the reasons you mentioned. I don't know if we know all the reasons, but I kind of think like you can make the same argument of like, in some way, I'm not comparing it, but this is me playing devil's advocate. Don't get glasses because nature would give you good vision. If it didn't give you good vision, you would die out pretty quickly. Like if you had Imagine like everybody today, right? I got LASIK, so I don't have glasses anymore. But if I had my vision 200 years ago, or in any time in the past, that would be so selected against because you can't really see very well. That's like a very big evolutionary pressure against that. So it's very clear to me that nature definitely designed us so that we can see, we should be able to see very well, but our lifestyles, mainly like being indoors, not getting enough sunlight, is making us all need glasses, right? And so I kind of think about, is that the same situation as wisdom teeth, right? Is it like, yes, obviously nature has designed wisdom teeth for a reason, but is there any situation where you'd be like, it's important to get rid of it?
Yeah, of course. It's not possible to keep them at points. The issue is more like, why are we degenerating? Vision is degenerating. We are losing teeth. We have no space anymore for our teeth. Why are we getting weaker and softer and softer and softer? Obviously, you said it. Screen time. Sunlight is the same for teeth. You need natural sunlight to produce vitamin D3 to get your minerals into your teeth. Same for the vision, for the eyesight. But also glasses is just basically, it's a cast. There's the same. When the glasses were developed, there was another school of thought when it comes to eyesight, from Russia, where they train your eyes in terms of muscle and they can all see. But no doctor will train you how to train your eyes and muscle because it's effort, but it's super easy to give you glasses. And obviously it's super easy the wisdom teeth. But yes, there are definitely situations, unfortunately, because of our lifestyle, that most of us need to take the wisdom teeth out, myself included. I had no space for them. I had braces twice.
Oh, wow. Okay. And you're saying you would have taken them off now if you know everything you know now, would you have still taken them off?
The problem for me was I had impacted wisdom teeth. Impacted wisdom teeth, understand, they would never grow out. So my development of my whole jaw was so poor that it didn't widen enough and lengthen enough. It stopped at one time, a point, but because I probably had a nutrient deficiency in the upbringing or sunlight deficiency, whatever.
And your dad was a dentist.
Regular dentist. He is still a dentist. Right. He's a biological dentist now, trained by myself, but he, yeah. But the story we have is, at least in Germany, and I think in the US is the same, is it's kind of normal that you have a school leave for wisdom tooth surgery. It's kind of like in the plan. It's just normal. You will look like this for a minute. They have to take out your teeth. Then you get the set of braces because everybody gets it. But for me, it's like I see a patient sometimes and like, wow, you have so beautiful teeth. Did you get braces and stuff? And you have your wisdom teeth. He's like, no, it just grew like this. And I'm like, damn, I'm jealous. Then your parents might have done a good job. And they always tell me I had no... my parents were really natural. They cooked their foods. We had we weren't allowed to go to McDonald's back then. We didn't have the 90s pantries. They were just more naturally focused and breastfeeding and no antibiotics like myself, because my dad is a dentist. My mom is a nurse, not a nurse. What is my mom? I don't know. Children. She works with children in the hospital back then. So I never know what it is in English.
Okay.
But both medically trained. Therefore, I would get antibiotics for everything as a kid because obviously they were afraid. I'm also vaccinated against everything, obviously, as a kid.
But not COVID.
No.
Growing up, that's the key.
Growing up against COVID, yeah. And yes, and this is a big issue in the upbringing. So my upbringing wasn't the best, and I don't blame my parents. My parents just obviously did it for the best. Same here. I have I myself have kids, and you know how it is. If you go to a doctor, general doctor, it's really hard to say no to these things because they have their arguments. You have to do this and you have to do that. So,
So let's go. Let's say, I'm going to want kids at some point. I want to make sure my kids have good teeth. Or a woman wants to have kids. What does she need to do in the womb? Like you said, you had these impacted wisdom teeth. How do we make sure kids' teeth are, they're good? Like from the womb. Let's go from the womb, and then let's go after that. Like, take me through. How do we raise a human species that has incredible teeth naturally? What do we need to do?
Yes, go as natural as possible. So if you can, as a mom, and I know not everybody can, breastfeed your baby for at least 18 months, which is 1.5 years, maybe even longer. Why?
What does that do, for example? Yeah.
Exactly. Breastfeeding requires strength to pull on that nipple, or pull on that breast, or suck on that breast. You need 12 times more muscle strength than from a baby bottle. And what it does, it pulls your jawbone and you grows forward. It pulls, so you get a strong jawline. And why? Because at the same time, it trains nose breathing. If you have something in your mouth, you have to breathe through your nose at the same time. Otherwise, you die. So you widen your palate and you widen and elongate your jawline. So it grows your skeletal structure of your jaw and basically your whole mid face. Most of us won't get breastfed that long. So I was breastfed probably for like 9 months, 6 months, which is actually quite good. But then afterwards is next phase. Now, what comes after breastfeeding? And obviously, I don't say you should 100% breastfeed. At one point, you give food for the kids too. They are weaning and whatever. But then obviously, you have to know how to think in nutrients and what do you need to build that body, because your kids are actually growing and they shouldn't do the kids menu. So they should eat proper whole foods, macronutrient design, protein first, and then the right sources of carbohydrates and fats. Basically how we did it, or how our ancestors did it. Stay away from processed foods and you are good, because I can answer this in the next question.
What does somebody need to, what nutrients do we need to focus on? So somebody stays away from processed food. So number one, right? You mentioned it starts in the womb. We started talking about breastfeeding, right? So that's number one. That's really important for dental health. Great information. I wonder if there's any device like that can mimic the breast to get that. Like that would be a good invention, like a bottle that mimics the breast. You know,
there are devices that kind of mimic the breast, but the breast comes also with other very, let's say, good information that you need, like oxytocin and bonding, all these things. So you don't want to mess. You don't want to miss.
Yeah. No, I agree. It's very hard to replicate breastfeeding in a formula, right? There's
formulas are so tough. Most of the formulas, if you look at but if you look at the ingredients, you could never feed this to your kid. It's like the worst design of everything. It's like a packed food of the most pro-inflammatory foods plus artificial supplements and fortified stuff, like really seed oils. You cannot, if you look at the standard thing, it's the nastiest thing. You cannot feed this to your baby, but unfortunately we do.
What is okay? So let's start in the womb. What does a mother need to consume in order to have healthy teeth? And I could just throw some things out there: calcium, vitamin K2, magnesium,
D3.
D3.
In pregnancy, you can Google this or Google Scholar. D3 declines in pregnancy. You need more vitamin D3 during pregnancy.
Okay. What about fish oil? Does that help?
Yes, omega-3 fatty acids, especially in the third trimester. You need to focus on a variety of healthy fats to produce cream. You want to feed cream to your baby.
Okay. I got
really
it.
Anabolic. It's like you
but
get
that's for breastfeeding. I'm talking about in the womb.
Yeah. In the womb, same.
Okay.
Because third trimester or mid to third trimester, the whole nervous system develops. So I would focus on DHA, EPA containing omega-3 fatty acids, especially if they're from triglyceride based. I wouldn't do the concentrates actually. I would eat fish. I would really eat meat, fish. I would eat butter, eggs, avocado, like the good stuff. Also carbohydrates, you will need them to produce your hormones. You need a lot of bit of insulin production going.
What about vitamin A is very important for tooth development, right?
I wouldn't, if you eat an animal-based diet, you wouldn't need to supplement vitamin A. I think it's enough in food. But if you're vegetarian or vegan, you definitely need to look it up.
Okay. So, did I miss any important nutrients besides the one that were mentioned?
Number one nutrient that most people miss is the macronutrient protein, especially amino acids, especially during pregnancy, because a pregnant woman goes through around about 5 marathons. It's that high of an energy expenditure and demand in terms of recovery. It's insane. So really 2 grams per kilogram lean body mass protein is minimum requirement in pregnancy. It's generally the minimum requirement in my opinion for optimal health.
Do you think that for dentistry related things, women are not getting enough protein?
Yes, not just women. Also, like I see a lot of patients, and most people, the recommended daily allowance is like 0.6 or 0.8 grams per kilogram. And I recommend 1.6 to better 2 gram, at least during surgery and all these phases. And I see a pregnancy kind of like a surgery phase. It's an intense endeavor. It's like high athlete work. So athletes should consume a little bit more protein.
Okay. So that was the one that we missed. Protein is extremely important for dental development, whether it's the kid, the mother, the whole shebang. Throughout the development phase, the kid needs to consume enough protein.
Protein, healthy fats, we had that. And then what you said, D3, K2, calcium, magnesium, zinc, boron, maybe like the few trace minerals, a nice electrolyte, obviously.
Okay, we missed zinc and boron. So zinc, boron, those are important as well.
Zinc for sure. Boron as trace element is very good for a lot of things. Look up the study, nothing boring about boron. Best review. Like you find everything in it. It's a review on PubMed. It's really good.
And I would also just like to say that there's certain nutrients. For example, I was always deficient in zinc from an early age, even though I always consumed meat. And when I look at my genetic predisposition, it shows that I have an increased need for zinc. I have lower zinc levels.
Have you ever tested if you have a so-called cryptopyruria, HPO it's also called, hem-pyrrolactamuria?
I've never done the test, no.
But this is
I've heard of it. I've not done it.
Yeah, the thing is, if you have this condition, so it's basically just a symptom of an underlying issue. For example, like your wisdom teeth that we removed. And your body just, in this case, it's a mixture out of chronic infection and inflammation and toxins. Your body changes biochemistry and you will lose zinc in a 24-hour urine panel like crazy, plus vitamin B6 and manganese and molybdenum. So look that up, and it's a common symptom. This is why this is all structured in my pre and post treatments for dental issues, because a lot of people miss zinc. And because
so just so people could see a little bit, you could see that vitamin K and zinc, 2 of the nutrients that we mentioned here, I was always deficient on these. And
you have it in genetics also. Nice.
It's in the genetics. Yeah. I just pulled it up now in a diet. There's a diet and nutrition report, but these are the individual markers here. And it shows that I have an increased need. And I know from just health optimization for 20 years, and also from my labs, that I was deficient on zinc and vitamin K2. When I don't take vitamin K, even if I'm eating a lot of vegetables, by the way, it's funny because I could be eating a ton of meat and vegetables. My whole diet was meat and vegetables, which has a lot of vegetables have a lot of K. Meat has a lot of zinc.
Are you talking about K1 or K2?
So for me, I was deficient on K1 and K2. I need to eat a lot of vegetables in order to get enough vitamin K.
But
right.
K2,
and the K1 converts to the K2, correct?
No, actually not. K2 is a specific. Those are the mannakinones,
okay.
MK7, MK4. You need to get them from animal foods. The only really natural source in plants is so-called natto, which is fermented soy.
But it doesn't convert in the body, K1 to K2?
Not that I know of. Not that I know.
Okay.
Yeah, maybe it does, but this is your microbiome who does it.
Right. I thought of there was some kind of conversion there, but
usually your bacteria does it for you if you have the right microbiome. But
K2, it could be that my microbiome was also messed up, but I definitely know that I do better with more vitamin K. Right, like I used to get nosebleeds too if I didn't eat a lot of vegetables. So the vegetables have the vitamin K. And so if you have a kid with nosebleeds, it's most likely the kid needs more vegetables. In my case, I had an increase. Like I was eating more vegetables than any kid I've ever known. Right. So I think the genetic predisposition is really important for these kinds of things.
But you didn't know your predisposition as a kid. So you just by chance ate more vegetables? You liked it as a kid?
No, I got lucky in a certain sense that my mother was very into health, and she knew that she just kind of there was this thing called ground up salad. You basically put a shit ton of vegetables in a blender, you blend it, and then you drink it, right? It's like a smoothie. Yeah, you just put in like cucumbers, romaine lettuce, some tomatoes, and some other vegetables, and you just blend it in a smoothie, mainly cucumbers and romaine lettuce, and you just drink this down. It has a crazy impact. It's funny because I haven't done it in a really long time, but your whole body feels like holy shit. Like you're ingesting a huge amount of vegetables, and it's kind of it's pre-blended already. It's pre-digested in a certain way. And that would fix it right away. So that obviously is going to have a ton of vitamin K, and that's what I think really fixed it. And then after that, I just eating a healthy diet of a lot of vegetables, I never got them again. Things like that is what spurred me to eat healthy, even from a young age. So I remember I did get nosebleeds. It's funny because I forgot that, but then I just remembered right now, like, holy shit. I got nosebleeds for a long time when I was a kid, and I don't remember ever getting them now, right? Like, because I'm eating vegetables and a lot of vegetables, and what really stopped it back then was that blended salad. You just gulp pound of salad.
I actually can see that kids would do a blended. Actually, I would also do a blended salad.